so there are no misunderstandings. Was the Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Regarding the question around, did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market.
This is scandalous. Millions of people worldwide felt forced to get vaccinated because of the myth that you do it for others. Now this turned out to be a cheap lie. This should be exposed. Please share this video.
All right, let me bring in Dr. Peter McCullough. Dr. McCullough, we've said this all along, exactly what was said, that you and I were canceled and, suppressed and all that. Does any of this surprise you?
No, it doesn't. I discussed this with Rob Roos personally. I testified in the European Parliament, so I know him well, and he nailed it. Now, our CDC director at the time, Rochelle Lewinsky, came out in the summer of 2021, and she said the vaccines don't stop transmission. Do you know that most of the corporate mandates occurred after the CDC announcement that it doesn't alter transmission, it doesn't stop transmission? The only reason to have a vaccine mandate would be if we actually had an effective vaccine, which we didn't.
Yeah, we sure didn't. Now, I told you, those of you watching at home, I wanted Dr. McCullough to come on here every so often to give us an update. But before I get to the update, Dr. McCullough, I want everybody at home to understand this fact. Because I've been called a lot of names, I am not a COVID denier. COVID is real. Yes, this is something that people actually really had to deal with. Yes, people died from it. So we're not denying COVID and the issue that was a real issue. It was real. However, how bad it was, and of course the way things were treated and the vaccine is where I differ on a lot of those things. So having said that, I want to ask you a very pointed question that has come to me recently, Dr. McCullough. But is there any studies, anything that says ivermectin defeats COVID or prevents it from occurring?
There's about 6 studies now, all supporting the use of ivermectin. So it reduces new cases of COVID, reduces the risk of hospitalization and death due to COVID. It worked through a range of illness. One of the best cited studies is the ICON trial, which was done in Florida, 4 hospitals in Florida. Ivermectin given in the hospital reduced mortality by 50%. This was published in one of the best pulmonary journals. A tragedy was that the hospitals denied patients ivermectin. It's safer than Tylenol.
Well, it's safer than Tylenol. I rest my case, everybody that gives me a hard time about that. All right, so Dr. McCullough, let's go. You mentioned this last time you were on, and I think it's important that we bring this back up. For those people that did get the vaccine, we want to get them healthy. We want to do everything to get them healthy. Explain about the process that you've come up with to help that happen.
2 major publications now, one in the Journal of American Physicians and Surgeons, the other one in the PubMed listed journal Curious. McCullough protocol, base spike protein detoxification. We do this as a base. You can do this at home. Then we do, add other drugs and interventions depending on the syndrome. But what this is for most people who've had multiple rounds of COVID or at least one shot, the use of nattokinase, 2,000 units twice a day, bromelain, 500 milligrams once a day, and curcumin, 500 milligrams twice a day. These are all natural over-the-counter products. One can buy them on your own, don't need a doctor's prescription. Make sure you take it without food. And this works very slowly over time to give us the best chance of degrading and help the body eliminate the spike protein. The spike protein is the spine on the surface of the virus. It builds up in the body after the infection or after the vaccine. The spike protein causes long COVID syndrome, causes blood clots and the other problems. So we know where to attack. Unfortunately, it's natural products that help us get rid of it.
So if I've had the vax and I take those products, you're saying eventually I can get rid of the spike protein? Is it 100% it gets rid of it over time, or is it like 90%? What is the what's the ratio there?
You know, we're learning about this as we go. In my office, we've been now about 2 years into this. I've held some big calls in the UK. Doctors are doing it there as well. They're all seeing improvement. It's slow, probably a year or more. You know, the Biden administration spent $1 billion on low COVID. They never tested these products, and they turned up with 0 protocols, 0 new drugs to try. So this is the best hope I think people have. Now, we add other things to it. Believe it or not, you know, it's a new drug that we add as a nicotine patch. Smokers actually did incredibly well with COVID because the nicotine actually helps block the spike protein. We add hydroxychloroquine if patients' blood tests show autoimmunity, like Megyn Kelly. And so we use additional drugs when we need it, Gene. But what I'm telling you is we should do something. We shouldn't just sit back and be sick for year after year.
That's it. Do something. All right. So people can go get. We're going to send some stuff out, and if you're on the Flashpoint Army email list, you'll get that in an email. We'll send that back out to you. But they can also go to your website. Is that correct, Dr. McCullough?
Well, you know, I advise the wellness company as a chief scientific officer. They offer probably the best in class of these products. They call the nattokinase spike support. They add bromelain and curcumin, so it's called the ultimate spike detox. And they're all American source products. I think we have the lowest rates of side effects with wellness companies. So if you go to twc.health, go ahead and sign up there, and you can order through that. That's where I get mine. I've had my 3rd round of COVID now, Gene, and my ears are ringing like you can't believe. One of the things we know for sure is that the ear ringing goes away, the numbness and tingling, a lot of the neurologic side effects go away. It takes about 3 or 4 months. Wow.
All right. So it's twc.health. You can go on there. So listen, you know somebody that maybe took the vax and regrets it, or maybe had. Just don't give them a hard time. Tell them to go to that website and get on this protocol that'll help destroy the bad effects, the side effects. All right, so I got to make sure I get to this part. Dr. McCullough, what about this new variant, the J1 variant? I think it is. Tell me what that is.
J1 variant, JN1, a lot of us had it this fall, Gene, and this is a tougher one. This lasted for a long time. It had a lot of phlegm afterwards. We found that patients did need the nasal sprays and gargles, some over-the-counter supplements. Some patients I used hydroxychloroquine, ivermectin, or Paxlovid. And then I can tell you on the back end, when the sputum production developed, we used doxycycline very successfully. I think now the case is going forward, I'm using doxycycline more aggressively. So if people do get sick in the next few months, and they'll know it, make sure you reach out to the doctor, ask for McCullough protocol.
McCullough protocol. Thank you, Doc. Let me ask you this. As we're going down this year, of course, I don't know if you knew this or not, but it's an election year. And so we're kind of, I'm a little bit concerned. I can't speak for anybody here or where I work. I'm a little bit concerned that stuff's going to come out again, and a new something's going to magically be discovered that's affecting people. Well, I want to get your overall opinion. I'm not going to hold you to it. I just want your opinion about this year. Are you concerned, or you think we're going to be okay?
No, I'm concerned. World Economic Forum, WHO, multiple people are saying disease X, that there's going to be another virus that comes out of a biolab and could infect the world again, get us sick. That's another reason why at Wellness Company we actually have some kits. You can actually buy a kit ahead of time and be prepared with some evidence-based approaches with a guidebook as well as telemedicine consult if needed. I think everybody should get ready, Gene. We got burned with COVID. We can't let this happen again. All right.
So Doc, if I go to twc.health, I can get that as well. All right. So ladies and gentlemen, take a picture, write that website down, twc.health. Thank you, Dr. McCullough, for coming by, and we'll check in with you in a few weeks.